And we have celebrity facial surgeon over here. His name is Dr. Sam Rizk.
Hi, doctor.
He is with us this morning. Good morning. And
Good
you're going to perform
morning,
a live procedure for us. We have Diane here.
Diane is going to have some work done on her forehead. She's got these really deep lines right in between her eyebrows. Yep. She's got a really deep crease between her nose and the corner of her mouth.
Yeah, I know the feeling.
And you know those, well, as we age, the skin loses volume. And so the whole purpose of fillers is to basically fill those holes.
So you're going to put Restylane in there?
Well, actually, I'm going to use a combination of Restylane and Radius.
And what's that new Radius thing?
Well, the Radius basically is a filler. It lasts a year or longer. Restylane, with this new study, they say it promotes collagen. You can use Restylane around the eyes. Radius is going to be used around her mouth.
Now, I just want to just jump in really quickly because I think there probably will be a lot of people watching who are going, what are these Mike, Jarek, and Juliet Huddy doing, you know, talking about plastic surgery, doing plastic surgery around the ear. But again, it's important to note that this is, you're saying that these things encourage the production of collagen naturally.
Yeah, they do, because you see, the way they work is they induce a little inflammation, and the inflammation increases collagen in the skin. So that's how it works, and it makes a lot of medical sense.
The woman behind there is your assistant.
She's my assistant.
And Diane here is from Long Island. Diane, why do you want to do this?
My husband is quite a bit younger than I am.
Really? How many years? Well, you don't have to say that. But good job, sister.
7.5.
You go, girl.
And I just want to look younger.
And so are you
I heard
worried?
Dr. Rizk was the best, so here I am.
No, he is the best in the city. There's no question about that. But are you nervous at all about this?
Absolutely not.
Not? Okay.
I think it's brave that you're doing this on television. But I guarantee you, I've seen a couple people that have been in the green room who've also been worked on this morning by Dr. Rizk. And I mean, literally, the results are pretty amazing. And it happens pretty quickly. So basically, we're going to check back with you, but in about 40 minutes. Once you inject her in these different places, what are we going to essentially see?
Well, you're going to see instant gratification. You're going to see these holes around her, these deep creases, essentially just disappearing.
In 40 minutes? If you
Actually,
hang with
not
us?
in 40 minutes, in 2 minutes.
In 2 minutes, okay.
Yeah.
All right, let's start injecting. And now, again, the reason why we can see it right away is because it's a filler.
It's a filler.
You're going to plump her up a little bit.
Right. She's already been numbed up a little bit before.
Okay.
And what I'm going to do is start with her forehead. And
do patients say it hurts?
A little bit. There's a little pain. You can give different numbing medicines.
But please, beauty's pain, Mike.
It doesn't hurt.
We all know that. Anybody who wears heels knows that.
It's very tolerable.
My face is painful.
Tell me about it.
It hurts less than I would say a waxing.
I'm telling you, I think this is it. It was so funny going into
these two deep creases here. Inject those here.
I got it. Okay.
Yeah, if you're squeamish about needles, turn away. But it's really not that big of a deal. She's not really feeling it.
Does not hurt, Diane?
Pressure, but that's it.
I've heard it described like a rubber band snapping against your skin.
It just feels like pressure.
So I'm injecting the actual depth of the wrinkle. Now you can also put Botox up here, but the wrinkles here are so deep that they need a filler. So.
But this isn't Botox at all, is it?
No, this is a filler.
Yeah, it's
Botox is a muscle relaxant. This is a filler.
So you're going to do there, the marionette lines again, and around her eyes and below?
So I injected these two lines around her.
Okay.
So Botox, as you've mentioned, it freezes the muscles.
Yeah, it freezes, paralyzes the muscle. Depending on how much you inject, you can get a very natural result. And when you get
a very unnatural result.
A very unnatural result.
But again, this is Restylane. This is filling her face.
This is filling those deep wrinkles, and the reason why I'm using it, the wrinkles there are so deep that Botox alone is not going to get rid of it.
Are you finding that women younger and younger are coming in, or men for that matter?
Actually, most of my population are increasing in their late 20s, early 30s.
Because it seems like this is kind of a preventative thing almost. I mean, it could be if you're getting shots to build up the collagen or to produce the collagen.
You can't prevent gravity or age, but what you could do is look better at each stage of your
Well, continue to work. Move your way down her face. And
that looks great already.
I know it does.
I mean, you see that?
And we're going to see the finished product later on in the show, but we'll continue to check in with her.
Wow, I don't need to get in front of the camera. That was really rude of me, but I just couldn't help myself.
Now
wow. Okay, I'm not going to touch you as we do that. Okay, let's turn to American Idol, and we're going to be checking back with the doctor and Diane in just a little bit. Hey, we're back on the morning show. Woo, it's So exciting. Talking about the latest ways to make you look younger without having to go under the knife.
Yep. At the beginning of the show, hope you were with us, so we met plastic surgeon Dr. Sam Rizk, who injected 2 fillers, Restylane and Radius, into a couple of our viewers who wanted a fresher look.
Yeah, he did this about 40 minutes ago when the show started. Dr. Rizk also injected another viewer as well. We're about to see the results. So come on over here.
Here we go.
Dr. Rizk, ladies.
And
hello.
here we are.
Okay, so Dr.
Ah!
This is
I'm just kidding.
Stop it. Don't do that.
They look fantastic.
Diane.
This is Diane,
This is who you've been working on. This
I've
is
been
Dina over
working
here.
on
We're going to get
Diane,
to Dina in a second. So you've been working on Diane. Now,
Yes.
explain again what Restylane and Radius are.
Well, they're both fillers. Restylane is basically a sugar. It's called hyaluronic acid. And what it does is basically it fills deep cracks that we get as we age. Radius is similar to it. It lasts a little bit longer. It's a calcium microsphere. And basically it's, they say it lasts longer than a year. My experience is it lasts longer than a year.
So you did a combo of the two.
And the reason why I did a combo
Diane.
is some fillers are better than other fillers for different parts of the face. You can't inject Radius around the eye or in the lips
Oh, I see.
because it's white, so it shows under the skin.
Show us what you did at the top of the show here. You
So let-
started with her forehead, is that right?
I start with her forehead.
Okay.
And what you see here is these really deep lines in between her eyebrows.
Right.
Which, with Botox alone, will not get rid of the lines completely. So I injected in the crack, in those really deep lines, the frown lines, basically. I put Restylane here and there in the lowest part of the groove, and that brings it up, and it kind of fades it away.
Okay, you can use your hand because at home we can't see that red dot. You have a little
it's
pointer. This
Yeah,
right
use
here,
your finger.
right here, you can see where I'm injecting the crack right here.
Yeah.
And right there.
Okay.
All right.
So let's take a look.
Diane, did that hurt?
No.
Did not.
You had a little numbing thing put on your
I had
face
not
before
put
you
a
had
numbing
it
thing.
first. Okay.
Okay, then what else did you do?
Then I went to her area around her mouth, and under her eyes I put some Restylane.
Okay.
Around her folds between the nose and the corner of the lip,
Yeah.
I put the Radius.
Okay.
Okay.
The Radius is best used in that area.
Let's put up Diane before her full face there, and then we'll spin her around, okay?
Are you nervous, Diane?
There she is.
So excited.
Okay,
It's going to be hard
so
to
let's
I'm
see.
excited
smile.
for you. Okay. Let's turn
turn her
Diane
around.
around.
Let's turn Diane around. And here she
Good.
is.
Here we go.
All right.
Wow.
All right. Well,
So- Let me. So let me point out,
Wow.
this is less obvious.
Wow.
I also injected some Restylane around her eyes, these really deep grooves here, and some Radius
Wow,
in these
look at
creases.
that.
And you can see a huge difference.
Oh my gosh.
If you note here,
You can't look at the this monitor
yeah.
next to you, obviously, because you have to stare forward. But
you can
it's
see these
trust me,
deep
it looks
lines
good.
here and there, and you can see how much smoother
Wow,
this is
look at
here.
that.
Big difference. She looks
In less than an hour.
less than
Now,
an hour.
let me ask you this. How long, first of all, how long does it last?
Very good question. Longevity is a big question with fillers. Restylane is about 3 to 4 months.
Okay.
They say up to 6 months. My experience has been about 3 to 4 months.
Look at the difference there in her
But
eye.
it's still much longer than collagen. And
Yeah,
then
sure.
Radius up to a year or longer.
What are the risks?
Well, with
Side effects?
with any injectable, you can get an allergic reaction. I have not had, and it's not reported as far as Radius, any allergic reaction. Restylane, it's very rare.
Could you know about an allergic reaction before you injected?
No, because there's no skin test for either of them. But realize this, both of them are natural substances within the body.
Well, sure.
So it's very rare to get an allergic reaction.
Okay.
Let's see, that's interesting.
we have more
Yeah.
questions,
Okay.
though.
Okay.
Important
Yay.
ones, but let's
You look
talk about
gorgeous.
Dina now. What did you do for Dina? Hi,
Well,
Dina.
with